then I will introduce the principle, very basic principle. For example, usually we teach systematically, need, as I said, 9 years to finish all the curriculum. But here I just cooked for you, and so it's like a dal, bhat, and so I think you would like it. So why we need to study medicine? So in the ancient times, those people who have more time, more energy to study medicine, so then people, compared to normal people, they are more knowledgeable. That's why they are called doctors. But today, everybody is doctors. So when you have your health issues, you will look at your situation, health situation through internet and talking to people, read books, attending classes. Looks like everybody are doctors. So I think in a sense this is good. So everyone should know how their body system and the mind system works. Otherwise we're just kind of like swimming without knowing swim. So just jump in the water and somebody maybe will pick you up. You're just swimming. So if you know how to swim, then you are safe. So basically, that's the situation. So everybody want to have a healthy body. However, that's not impossible. First of all, I would say there's no person never been sick or never been any problems in their entire life. Because our life, kind of like the body, physical body, is everyday change. Change with in external stuff, like so every day it's like your car, so you have to fill the gas. So every day we eat, drink, and sleep, do things, and there's some imbalance or troubles. That's not a surprise. So the technique, when you understand the concept, and then you can manage it. So usually, I think in the Western society, you are educated in biomedicine concept. And then some people today, they're trying to learn Eastern concept. So Eastern concept usually comes from Chinese traditional medicine, Indian Ayurvedic medicine, and then third one is the Tibetan medicine. So these three in Asia is independent three in ancient medical systems. So some people today use from different parts and then they mix together and they impress people. So you can impress people, but sometimes that's more make a confuse. So right now, I would like you to forget any of your knowledge of health and purely listen what I say, and then later you can compare if it makes sense to you. Okay? So maybe that way more better. Have this 5 vital organs, 6 hollow organs. So this is like a mantra for Tibetan medical doctors. So we call it Dong Wa Nu Tu. So that's the categories we have to remember. So when you look at your physically the organs, this is the organs you have. Every one of us we have, except some people do a transplant. Okay. So the positions, for example, like how we find out. So there's a measurement. And we start with our finger size, okay? Finger size like 1 sword, and then tongue, toe, che. So we have a different measurement on ourselves. So then we can find out where the liver is, where the stomach is, and according to your measurement, okay? So that's how we find out. And today, a lot of modern science, they try to generalize or standardize. Sometimes there's kind of like a problem, a range problem. Because each individual is different. The size is different and the nature is different. And the physical we have this 5 and 6 organs, and then look at ourselves, and we are basically maybe 90 pounds or 150 pounds or whatever your weight is. This is a solid kind of like a flesh, bone, blood, hair, so a lot of things together. So, but then we have to understand how come this kind of physical body is together. So when we look at operate our body, we can divide 3 components. So the 3 components, for example, here. So the first one, I would start with the packet. So in Tibetan, we call it packet. So packet is that means earth, can means chu, the liquid. So earth or solid stuff and the liquid comes together. It doesn't make sense to separately talk. So because if they're separated, they cannot exist independently. So our body, okay, base of our body is water and solid. So this combination we call a packet. So for example, your flesh, your bone, hair, or anything you can touch. Okay, that's the base. And then on that, you have a heat system. Heat system we call the Tiba. So in your body, always there's a temperature. If there's no temperature, the body is dead. Okay? However, in the dead body, also there's a certain level of temperature. Because otherwise, the body will not stay together. I usually make funny with my audience. So there's a movie called a Mummy. So when the mummy, like a sand, so then the liquid dries, the heat goes away. It's like the person stays like became sand. It doesn't stay together as like a body. Okay. So the heat always inside of our liquid and also our the solid part. So then the third component is more important. And the other third component we call the lung. Okay? So lung, we call it lung, and also you can translate into like air or wind. But this culturally it's difficult when you think about wind or air. So when we say in Tibetan like a lung tipa peking, we don't need so much explanation. That's why earlier I said that Tibetans are very comfortable with this medical system. So when you translate into English, it's a little bit awkward. So air or wind is actually the gas, okay, oxygen. So something, the solid thing and the liquid of your physical body, there is a